how we can turn this into this without surgery. This patient presented with a class 2 division 1 malocclusion. And at first glance, it may seem like the problem was only in tooth position. But in reality, the key issue was maxillary deficiency, which significantly limited the possibility for simple orthodontic treatment with just brackets. So we did not start with alignment. We started with correction of intermaxillary relationship. And for this stage, we used the carrier appliance. In addition, we introduced our modification, a rigid stainless steel retainer extending from the first to the fourth tooth. Why was that important? Because with carrier mechanics, distalization is often accompanied by unwanted side effects. The second molars tend to move more buccally, and the distal aspect of the first permanent molars may become embedded into the mucosa. In other words, distalization itself becomes limited. So, in this case, the correction was achieved not simply by moving the upper posterior teeth distally, but mainly through occlusal reorganization, anterior positioning of the mandible, and 3D correction including extrusion of lower first molars. And this phase lasted 9 months. After that, we continued with fixed appliances, and the braces phase lasted only 13.5 months. Before treatment, all third molars were removed. This case shows very well that when treatment is staged correctly, it is possible to achieve a result that in many situations might otherwise be considered achievable only with orthodontic surgery. The cephalometric changes demonstrate the result especially clearly. The improvement in occlusion and overall bite relationships was truly substantial.